Вітаю вас, шановні друзі, вітаю вас, шановні
Welcome, dear friends, and welcome, dear colleagues, at our 10th seminar workshop on track to improve health of women living with HIV, Ukraine, organized by WAVE, Women Against Viruses in Europe. It's part of the EX family.
Україна, який організовано робочою групою ВАІФ «Жінки проти вірусів у Європі», яка є частиною сім'ї ІАКС. Прошу пробачення, це дубль.
Sorry. It was just repeated. So in the beginning, I would like to say that today and tomorrow we are going to work during this workshop. Tomorrow we will meet at the same time. And the topic for today is pre-exposure prevention for women in Ukraine, in Europe. That's the topic for today. And first of all, I would like to introduce our chairs, Caroline Abbey-Pop. She is a gynecologist doctor from Bern, Switzerland, and she was the one to inspire all of us to create the whole series of webinars. Now we are doing them online, but the series of webinars on track to improve health of women. Caroline, the floor is yours.
Thank you very much for this kind introduction. I'm very glad that it's already the 10th workshop. It's kind of a celebration of this wonderful seminar and workshop of our exchange, and which has taken place only once live, but I think we're gonna repeat that and keep our collaboration for long. EAX is really a family, like Sergei said. It's a network community. It has medical professional, it has community, and it's really a regional balance across the region. So it's very dynamic. So we're facing many challenges, and this is important that we always stay together, and that this is a sustainable thing, like this workshop and other activities in WAVE. The involvement is really growing. We have more and more people joining WAVE, and we're really happy to get more projects running. And EAC's vision to support people living with HIV is also aims to fight against stigma, and it also aims to change inequalities. And one of those is, for example, the prevention strategies across the region. And today I'm really, really happy that we have one of those topics that is in regard to prevention very important. Because we know PrEP in most our cases and studies, we know PrEP using for men who have sex with men. And today I'm so happy that we can discuss PrEP for women and access to PrEP and best strategies to inform women that they can have and they can benefit from PrEP. So this is really, I'm grateful for everybody who has said that they would take part of this workshop today. And I'm looking forward to a great discussion. Thank you.
Дякую. Дуже дякую, Кароліна.
Thank you really much, Caroline. And also I would like to introduce Ms. Svetlana Antoniak. She is an infectious disease specialist and researcher at AIDS and Viral Hepatitis Department at the Institute of Epidemiology Infectious Diseases, named after Lev Kromashevsky, Kiev, Ukraine. Welcome, Svetlana.
Дорогі колеги,
Dear friends, I'm really happy to greet you all at our 10th WaveEX webinar on track to improve health of women living with HIV in Ukraine. And also would like to warmly and heartily thank you for showing interest, and regardless of being so busy and having a lot to do, still you found time to participate for an hour and a half and be together with us for 2 days to discuss very important topics of pre-exposure prevention of HIV and HIV testing, with special focus on needs of women. Also, I would like to say a very warm words of gratitude to Dr. Caroline Abbey Pop, because today she is a chair of our webinar, Doctor of Medical Sciences, Master of Sciences, working in the infectious diseases unit, University Hospital in Bern, Switzerland. And she is a head of WAVE. When she was a head of WAVE back in 2019, she inspired all the series of our seminars, of our webinars on track to improve health of women living with HIV, and together with a professor of Warsaw Medical University, Justina Kowalska, and Professor Fiona Malkahi, working in St. James Hospital in Dublin. And at that time, she was a vice president of European Clinical Association on AIDS, EACS. And we had our first webinar like that in Kiev, then the next one was in Lviv, and over the last 5 years, we've had a lot of them. So today it's the 10th webinar. And I'm very much grateful to you, our dear European colleagues. I'm very grateful to our major speakers, Anka Steinu-Chersel from Romania and Dr. Tetiana Melnik, working and living in France. And thank you all, the dear participants, for continuing to help Ukraine. During the COVID times and now during the war operation times, we are still cooperating and collaborating online, but I believe, dear Caroline, dear all, that we will meet live in Kiev again. We'll go to the ballet opera and ballet theater. Thank you very much also to Diana Shevchenko, working in PHC Center, and Alina Dudko, infectious disease specialist from Dnipro City, and she's involved in PrEP. I would like to thank them for participating in our discussion as well. So I would like to thank everyone for the possibility, for the opportunity to be able to discuss very important topics for our women, pre-exposure prevention with focus on women. This topic is very relevant to Ukraine because we have some specifics of the epidemic in Ukraine. So we have found 150,000 people with HIV, and as of today, 116,000 are on ART. So as of now, regardless of the fact, the majority of new cases are men, regardless of that fact. So in the first quarter of 2024, for example, 2,756 new cases were registered among men, and more than 35% of them are women. But the overall cohort living with HIV in Ukraine, women are 46%. In 2023, regardless of the war, military operations and challenges, and 1,015 HIV positive women gave birth to children. And unfortunately, 15 babies were HIV infected from their mothers. This is early diagnostic tests that were used to see that. So the scope of the epidemic in Ukraine is dramatic, and it's necessary to take needs of women and children into consideration. And we need to do everything possible to work with that. So dear participants from Ukraine, we are also very grateful that you're with us, regardless of difficult times for Ukraine. Still, we are part of the webinar. Serhiy Antoniak is the moderator. He is a researcher of viral hepatitis AIDS unit at the Institute of Epidemiology Infectious Diseases, National Academy of Medical Sciences, Ukraine. And he is a member of the WAVE committee as well. Thank you. Thank you, dear Svetlana. And now, if I may, dear colleagues, I would like to give you an overview of our agenda and also introduce the speakers and the participants to the discussion. It is true, the overall topic for today is PrEP for women in Europe, the access and implementation. We will start from the mini lectures of a wonderful specialist from Romania, Anca Străinu-Cercel. She's a professor and working in the infectious disease unit, medical and pharmaceutical University Carlo de Villa in Bucharest, and also in Matei Balș University, and she is associated member of the Academy of Romanian Scientists. Anca, thank you really very much for joining us today. And after the mini lecture of Ms. Anca, we are going to have a brief, short discussion, and then we will continue on with another mini lecture of a person from doctor from Ukraine, Tatiana Melnik. She is a doctor of medicine and specialist of clinical research working in Saint-Antoine Institute in Paris, France. Ms. Tatiana, thank you for joining. And then after that, we are going to have another discussion, brief discussion session, Q&A session, and we will complete with a mini lecture of Diana Shevchenko. It's PrEP for women in Ukraine as one of the key measures of comprehensive HIV prevention. Diana is an infectious disease specialist, the unit of management and response to HIV epidemic, PHC, Minister of Health, Ukraine. Welcome, Diana, and thank you very much. And after that, after the third mini lecture, there's going to be the overall general discussion of any questions that we might have. Alina Dudko is going to join in at that time, infectious disease specialist, City Clinical Hospital number 4, Dnipro Municipal Council. Alina, thank you. Happy to see you. So, dear colleagues, before we start, also I would like to give some household issues. I would like just to tell you that you can put your questions in the chat anytime during the lecture or during the discussion. We'll be really happy if you really ask your questions, and we will do our best to answer all of your questions. Another important thing, we are going to have a recording of this webinar, and it's going to be available for a couple of weeks. And if you would like to go through that webinar again, or maybe share it with your colleagues, so please do that. We'll be happy if you do that. With regards to the certificates, in order to get the certificate, you will have to undergo the questionnaire, like it's going to be a survey. It's going to be on the website, and the link to that survey will be in our chat, so you can use that. And after you complete that survey or you complete that questionnaire, and actually, by the way, it's not to assess your level of knowledge. It's just we would like to get your feedback about the webinar itself, whether you liked it or not, or how to improve it. And also, you will get the certificate within a couple of weeks after the webinar. Thank you very much for your attention. That's all. And now I believe we can start the mini lecture of Ms. Anca, PrEP, HIV PrEP for women in Europe.
So good afternoon. Thank you for the kind invitation to join this meeting. It is my pleasure to talk about a theme that is really keen to me, and we are talking about women in Europe, and we are focusing on the PrEP, which is quite important for this category of patients. So my presentation will be focusing on where we are, where are the data regarding PrEP in Europe. And this is a last report from the ACDC. The data we're presenting starting this year, and we will have a discussion later this week regarding how are we focusing and which country in European Union do have access to PrEP. As you can see, we have 28 countries that in the European Union say they responded to the survey regarding PrEP. And in these 16 countries, PrEP is provided or reimbursed. And the countries that do that are starting with the Belgium and even countries in our area, in the Balkan area. Some of them do give access reimbursed to our patients. Romania at this time point is not one of them, but we will discuss some data that we have regarding that. As I am living in Romania as a professor of infectious diseases, and I am a physician treating HIV patients. So countries like Germany or France have a huge experience treating patients. Treating patients and treating their partners and using PrEP. Even as a resident, in the time that I spent in France, we offered patients and subjects PrEP at that time point in different areas for different periods of time. But that changed, and the patient that we are focusing on are mainly MSM, so not women, which is a focus point of our discussions. Again, in other 9 countries, there is some generic PrEP that is available in healthcare settings. They are not fully reimbursed, but they have some kind of a project by which they gave access to PrEP. In other 5 countries, PrEP is only available through pilot research and demonstrative project, as is the case also for Romania, but the other countries in our area. Of course, we have some countries where there is no formal implementation of PrEP, and this survey was focusing on patients MSM, so men having sex with men, not women. If we are looking at the map of Europe regarding PrEP implementation in Europe and Central Asia, we can see that dark green means there is national availability with fully reimbursed, and the lighter green means there is not fully reimbursed, but generics are available and not formally implemented are in countries that we are talking about. As Romania, but as I can see, Ukraine is quite green. So there is fully reimbursement for PrEP, which is not the case for Romania, which is my home country. Regarding issues which are preventive access in some countries, usually the main concern of this survey was that there are concerns about increased transmission of other sexually transmitted infections, as we presume that when we are using PrEP, we are not using condoms. We should come around, and at least when we did our project, we talked to patients and we really reinforced the fact that we need to use condoms as well. PrEP is only helping for HIV, not for the other STDs. And different others issues were identified. Regarding who should be eligible in the K population that we are talking about, you can see that on the first place there are MSM population that have association and NGOs that play an important role in having a voice regarding access to PrEP. Then there are transgender people, sex workers, and you can see that women as a separate column are not listed into this column. So when we are talking to them, we should have a voice for them and try to offer them PrEP. What are the settings in which PrEP is available across Europe and Central Asia? You can see that mainly infectious diseases clinics and public facilities are the most important one. So ID physicians really play an important role, but other specialists also work together. And there is a huge resource that is called the internet, where patients can buy medication, generic drugs, even if they are not fully recommended by a doctor. And that comes with a price regarding, is that medication really working? Does the patient, subject, not patient, at this time point really knows how to use that PrEP in the right way? So regarding how many people are receiving PrEP, again, in Europe, you can see that the 2 countries that I already mentioned at the beginning, Germany and France, are the main areas where PrEP is used. Then comes all the other countries with limited access to PrEP as the number of people who are receiving. The availability from 2022 is also listed over here. It's kind of overlapping with the first map that I showed, but on this one, I only want to emphasize that these gray areas where Romania is listed is linked to availability for special categories as migrants, which are really an important category of patients. Of course, PrEP comes with some costs that are different in different settings, and there are different ways to reimburse, some in private facilities, some in public facilities. And regarding what will be the cost for sexually transmitted infections, there is a screening and there is a free availability that, of course, is more in the public facilities and less in the private facilities where you do have to pay for them. They are available, but they have a cost. So this is something that we have to keep in mind when we talk about reimbursement of as well. Of course, there are some priorities for actions like national guidelines, which should be a useful tool in guiding implementation of national PrEP, and that should be something that should be available in all the other countries. Different countries are encouraged to go to different strategies, and there is a whole paper on the ACDC site that I put the link below where you can find all this information. But what I want to focus is this article that was published last year. It's really focusing on PrEP for women in Europe and is a systematical literature review. It's a survey by the WAVE, as we are here at the WAVE webinar, which looked at the variation of PrEP access and guidance for women this time through Europe. And it's important to look at this because our main focus is regarding women and how they have access to that. I know it's a survey from 2021, but it's still available as not much has been changed till that time point. So they looked into almost 5,000 articles, and the majority of the study, as we already mentioned, were done in MSM, were in transgender women. And from these studies, we are talking about really the maximum number of patients that I have seen in an article, the patients, women who received PrEP, 4,699. These studies, however, few studies were really women focusing. So they really took place outside Western Europe. So in our area, still we have limited data and we have to rely on this kind of studies. Across preclinical studies, they reported women-specific outcomes, which is really important, but not that many women were included, as you can see. And no breakthrough infections were recorded during the use of PrEP. What we know from other clinical trials, and I'm talking about treatment, we know that women are more adherent to treatment and they do access more the healthcare facilities than men in this category, which is really nice. What other thing is important for me to focus is the fact there is a lack of awareness that PrEP exists for women, and there is a low self-estimation of HIV acquisition risk that it's almost really important to focus. And there are some concerns regarding stigma, lack of protection against other sexually transmitted infections. So we should be aware that there is some risk regarding drug-drug interactions with PrEP for hormones for transgender women and also for contraceptions if we are talking about different types of PrEP. So this is something that we should be aware of it. Again, we should know that we do have some work to do regarding PrEP in women from the point of view that more research is really needed to see how we are using PrEP in cis women, in pregnant women, and in breastfeeding women regarding how we can do that if we really want to stop the HIV transmission by 2030. Now, focusing a little bit on the situation in Romania, this is how it look like. We have the youngest population in Europe, and we have this population of men and women, almost 34 years old, that are coming up from the former pediatrical cohort. So they are now adults exposed to a lot of treatment. Why am I focusing? Because this young age population has partners at this time point, and half are men, half are women. So they do have some partners that we need to talk about it. What we implemented in Romania is this project that is mimicking Octave from France and Spain. We called it Roctave, where we ask our patients regarding patient-reported outcomes in 8 categories. Why am I mentioning this? Because we ask them what will be more important regarding these 8 dimensions, including sex life and how they can protect their partners. And they agree with us, and this is what I want to focus, the fact that my sex life is an important issue that I want to discuss with my doctor, that I want to discuss with further physician, and PrEP came up as one of the most important issue when we talked about how can we protect our partners, even if they are men or female, and I'm talking about discordant couples where one of the partner is positive and the other is negative, and how can we prevent this kind of transmission. Another focus point that I want to make is regarding what we did with the project with our colleagues from the United States, from the State University of New Jersey, was a pilot project at the National Institute of Infectious Diseases, Matei Balch, where I work, where we implemented an app and we gave patient PrEP, again, focusing on MSM patients. So the 2 points that I want to make regarding this study that we already published, the data, is the fact that PrEP was easy, calm, so the patient really wanted to get involved, and not only to get the PrEP, get the information from the team that was part of this project. We have psychologists, doctors, nurses that really educated patients when they gave PrEP. And I think that is the most important thing regarding education. Not only gave patient access to PrEP as a medication, but also to knowledge and talk to them and tell them more than just the HIV transmission. Also, other sexually transmitted diseases, they can get vaccinated in order to be protected, as for human papillomavirus, for example, because we are talking about women and we are talking about the possibility of developing cancer, and that should be a recommendation. I know that in some countries it's reimbursed, in others it's not, and it has quite a high cost, but it's really important to also know how we can protect women for developing other problems that can go into the pathology of infectious diseases. So the patient willingness to, the subject's willingness to take PrEP was really huge. They were, regarding PrEP persistence, we had a high PrEP persistence of 95 of them, and only one patient said that he really thinks he doesn't have a sexual risk, and he dropped out of the study. What was our conclusions at that time point in 2022 is the fact that we need facilities, and patient also need counseling, and we need to go from MSM, which was a focus point of this project, to women as well, because we need to focus on heterosexual transmission, and we need to focus on the serodiscordant couples in Romania, as I mentioned, epidemiological data. So now we are working of implementing the PrEP as an important tool for serodiscordant couples. And we will see their willingness to participate, because we do have a high number of new cases of HIV infections which are registered every year, and they are in the age group of 30 to 40, and they are quite young, and the majority will say, I didn't expect to get HIV, and their partners said, I didn't expect to give HIV to my partner because I do that and that and that. So PrEP can play an important role in talking to them and making them more aware of the risk of transmission. Even if we know that we are using undetectable means untransmissible, we know that undetectable, sustained undetectability really means untransmissible. So we do believe that it's an intervention that is really worth implemented, and we should focus on the population of women and give them more information in order to have a decision that is really important for all of them. So regarding the focus on women, we should first assess knowledge and attitudes about PrEP among women and among heterosexual discordant couples. We should assess their acceptability and uptake of PrEP among the category of women, and we should do that in its ongoing survey regarding their willingness to participate, because it's really important to focus on that. We know that all the data from European Union said MSM are the main focus point, but also women should play an important role. And if we want to implement PrEP, it's really important to know the epidemiological data, to know your risk factors, and to work on them if we want to stay aligned with the recommendation of getting down HIV transmission by 2030, which is not that far. We are in 2024, so we have 6 years in which to really see the results of our intervention and of accesses to PrEP for all women, so to say. We want to have also educational objectives because, as I already mentioned, we need to somehow promote sexually health issues if we want to reduce HIV-related stigma, which is still important. I know there is a project, European project, which is called, which is linked to HIV and stigma, and is linked to the fact that women need to access services, gynecology and services, and they need to be aware that HIV is still a sexually transmitted disease, so they should talk about it. And each chance we have to talk to our subjects in order for them not to become patients should be something that we should work on it. So each of these steps is really important, and we should focus on all of them if we really want to focus on lowering the burden of HIV, because there are some category of patients that we should focus on, because antiretroviral intervention should be also involved in preventing breast milk transmission in HIV, in transmitting the resistance, because it's another important step, and also the antiretroviral therapy for treating HIV-infected women should be an important focus point, as these are just some of the highlights of the articles that I wanted to focus. This is not instead of the conclusion, is the fact that I have only talked about PrEP for women, where we are at this time point, where we are in Europe, where we are in Romania, some data from Ukraine, and this is something that we should focus on, because PrEP is here, PrEP is available, women are here, and they are not, and they should be aware that PrEP exists, and it should be a useful tool in order to decrease new cases of transmission in Europe as a whole Europe, because the borders are not borders when we talk to the transmission and when we talk about HIV. As the last year also focused us, we have new cases of HIV that are increasing all across Europe, so we should do something, and PrEP is a right tool to do it. Thank you for your attention.
Я хочу дуже подякувати. Хочу
I
очень
would like to thank you really very much. I would like to say thank you really much, Professor Anka, for this wonderful presentation. And it was really interesting to our participants because we've got quite a lot of questions already. So we will try to answer at least some of those questions. Thank you again, really very much, Dr. Anka, for your wonderful presentation. So how about the questions? Right, we have we do have lots of questions from our participants who are online. So we will start. So the first question, is there any peculiarities, specific features in your country with regards to implementing PrEP for women? And if yes, what are they? And do women require some special interventions with regards to adherence? Thank you.
Thank you so much again for the kind invitation to join the meeting and join the discussion. I think talking about PrEP is very important, and thank you for the question. So just to answer the first one, I will go to the introduction where Professor Svetlana mentioned mother-to-child transmission. There is an important issue that is linked to women and only to women. So definitely, if I'm going back to Romania, even if we do not have access for women to PrEP at this time point as the usual tool, so just coming in, getting PrEP, we are working on that, and we are starting working on that from our discordant couples. As you know, our epidemic is a little bit different from the other European countries, so this is why we wanted to focus on discordant couples and trying to see how PrEP really works on them and try to offer access to them. So we are offering access to women who they have their partner who is HIV positive, and also to men for which the woman is HIV positive, in order to decrease the stigma that I kind of mentioned in my presentation, but it's really an important fact. So it's a pilot study offering access to 100 couples. And we are hoping to gain some financing, because everything is linked to money and access to money, in order to continue and give access to all the other centers in Romania, which are 9 in total, and to try to implement the same project in all of them, not making people come to the capital of Romania to get PrEP, but getting PrEP to all the corners of Romania, because with that, it will be really be working. With what we are doing at this time point, we are just showing that it works, but we have something more to do regarding that.
Дякую. Дякую за відповідь.
Thank you for your answer. Caroline, it would be interesting to hear about the situation in Switzerland with regards to the same question. And also, I would like to mention in general, any participant or any speaker, if he or she wants, might answer the same question. So it's not that we insist that everyone speaks, but we'll be happy if there are thoughts from other participants, other speakers. Thank you. So sorry, Sergey, sorry, Caroline. Go on, please.
Thank you very much, first of all, Professor Anka, for the great presentation. And in regard to Switzerland, as a small country, for us, the most difficult thing, and this is what Professor Anka also said, is the low self-estimation of HIV acquisition risk in women. So it's really hard to get that information to women to see who could benefit from pre-exposure prophylaxis. And this is something that needs more information. And we are trying through gynecologists, family planning clinic, contraception clinic. And in regard to pregnant women, there's no use of PrEP so far, and breastfeeding as well, because you can only breastfeed if you are undetectable. But I really liked your idea to reduce that, or to get that information to women who might not come and look for PrEP because they can't estimate, or they just don't know. And I would like to have a question to Professor Anka too, what she thinks about defining better guidelines across, for example, in the EACS Society for PrEP use in women, and what it needed to do that, and how you think this could be done better in the future.
Thank you. That is a great question and a great way to talk about it. But unfortunately, or fortunately, so to say, last week I talked in Barcelona at the meeting regarding with Timor Nori as well, regarding this is where we are, regarding PrEP in Europe, and what can we do? And I remember that we published an article in Neurosurveillance linked to screening for HIV. What is the recommendation for screening for HIV in other specialties, not infectious diseases, all around Europe? And I was amazed that we are still lacking information that we give to our colleagues linked to the AIDS-defining diseases and to HIV screening, so recommending a test. In some specialties, there is recommendation, there is linkage to symptoms, but there isn't linkage to testing and there isn't linkage to the HIV specialist. So, and I'm talking to the whole patients. Regarding women, there is even less data regarding that and regarding them access to this kind of information. And I do believe that it should be a subject that needs to be addressed separately, as you said, with the EACS and with everybody linked to that, because women do need access to information that is given to them in a way they can understand it, and they need addresses where to go in order to get the information and get testing and get access to PrEP. And I do believe that if we do like a survey, like you did in the past with that articles that I already mentioned, you will say that we have a need and go forward with the steps in which imply implementation of that.
Thank you.
Thank you.
Так, дуже дякуємо.
Yes, thank you so much.
Можливо, є у вас також у наших учасників дискусії.
I would like to ask maybe our discussion participants have questions. If not, Diana, yes, you're most welcome. Dear Ms. Anka, thank you very much for this wonderful, amazing presentation. To me, it was really interesting to hear your experience. I would like to ask you about the information raising awareness campaign and PrEP. If I understood correctly, the services are provided in the capital of Romania, but do you provide information in other cities with regards to how to get PrEP services? Thank you.
There is a very good question. We do it online, but it's limited. Even if all our patients are young and access with technology, as our meeting is nowadays, so everything is online, we provide information on website where they can access, but unfortunately, we cannot provide treatment. So we used, I don't know if it's really good that I'm saying that, we are using post-exposure prophylaxis as PrEP in order to be able to give them access to some kind of treatment, because that's the only way we can get finance for that, to be honest. But we still have some more work to do in order to go with our government to say how important is this step in order to get PrEP, not post-exposure prophylaxis, and the difference between one another and the impact it might have on their health, on the stigma, on everything, which is quite important. So no, regarding reimbursement, yes, regarding information, and somehow the reimbursement and the online internet where everybody get access to different drugs, not the one that we really want, but it works at some time point. So
Дякую. Велике спасибі.
Thank you very much. And another question with regards to the ability to get PrEP from your own pocket, for your own money. Is it possible to do so in Romania? And how much? What is the cost of PrEP per 1 month of treatment? Like treatment plus laboratory tests that are necessary to supervise the patient. Thank you.
Regarding laboratory tests, that is something that the subjects can address, and they can be reimbursed. Regarding the price, if they have a recommendation and prescriptions from a medical doctor, for an infectious disease doctor, they can get it from the pharmacy. And the price is around, I will transform it in euros. From lei, it's around 20 euros per month. So it's really low. Well, it's affordable, so to say. And the recommendation linked to all of that are given like from the medical doctor, infectious disease doctors, from the emergency rooms where they access these services. And we do have plenty of emergency rooms for infectious diseases all around the country they can address. So prescription is kind of reimbursement, but we do have the recommendation. So we are mimicking we have a file that we need to complete when we are talking about post-exposure prophylaxis. We are using that in order mimicking it for pre-exposure prophylaxis with everything that is linked on that in order to have prevention for everything else.
Зрозуміло, дякую. Тобто,
I see. Thank you.
Thank you.
Алина, вы хотели задать вопрос? Да, извини, Сергей. Да?
Alina, did you want to ask a question? Right, I have a question. Anka mentioned that patients buy PrEP from internet, via internet. It's interesting how it is done, who controls that, or if it is controlled, who does tests and who sells the drugs for PrEP. And it seems to be that information is online, not the sale.
Вибачте, там
Sorry, but please, Anka.
про купівлю в інтернеті.
It's about buying from internet.
Well, I don't know how it works in other countries, but for us, for some of the subject, it's possible to buy them online from online pharmacies. So they are the drugs that are available also in pharmacies, but they can buy it on drug without any prescriptions. The difference from a pharmacy and an online pharmacy is the fact when you go to a pharmacy, you need a prescription from a doctor. That means that you need to see a specialist, and that specialist should spend at least 5 minutes with you telling you what you should do with the drugs, how you should take them. Regarding online part, I do believe they take it by itself. Then they come to the hospital and telling us we have taken these drugs, especially we are talking about tenofovir, to be honest. The generics ones, they are taking it and saying I have been taking it like it said on the link on different sites. There are sites from the patient association that are really good with all the information they need. But I do believe that we still need to do testing. We still need to address other knowledges, because when you do it like that, HIV is an STD, a sexually transmitted disease. So you need to do everything in order to get the prophylaxis right. And we should not forget about some of the late presenters that are coming into the clinic that have been taking PrEP for years. And there we might have a problem linked to resistance and all of that. So definitely we need to talk to our subjects in order not to get patients at one time point. So I do not encourage buying from the internet. I do encourage subjects to come to the hospital, reach for help, reach for a talk with a doctor, with a psychologist, with a nurse, because we have the whole team that can talk to them. But they need to spend more time with us than 3 clicks on the internet that they do at midnight and provide what they think they need at that time point.
дякую, дуже дякую.
Thank you really very much. Do we have time for more? I think for one more question, and then we will have to switch to the second mini lecture. So the last question is, dear Ms. Anka, you mentioned about using PrEP among serodiscordant couples, and the question is about those couples. So in Romania, what do you think about continuing PrEP in serodiscordant couples when HIV positive partner reaches undetectable level of viral load?
Well, our recommendation linked to that is the one that is followed all around the Europe. So undetectable means untransmissible. With the fact that we say sustainable undetectable, so the two being undetectable for at least 6 months, in order to be sure that he or she is highly adherent to the therapy, in order not to miss any opportunity as a time point. We go with that. We have discordant couples with some of our patients from the former pediatrical cohorts that have a low level viremia due to the fact that they have been exposed to all the antiretrovirals, and we have problems linked to resistance. So over there, we could not say they are quite undetectable with low level viremia. So in that couples, we do recommend prophylaxis, and we do recommend PrEP if they want to have unprotected sex, not using condoms, and if they want children, because that is one of the issues that our patients have at this time point, being young, like 30 years, they do want to have children of their own, and they want to do anything they can in order to decrease the mother-to-child transmission or the transmission to their partners. So we are using that as well.
Зрозуміло. Дуже дякуємо за
I
відповідь.
see. Thank you really very much for your answer. So we have to move on our agenda. We're a little bit behind, but that's okay. The discussion is really interesting, and we still have more questions. Hopefully, we will have more time at the end to discuss more questions. And now I would like to give the floor to Ms. Tetiana Melnik, and her mini lecture is going to be PrEP in France. And the focus is on adherence. Ms. Tetiana, you're welcome.
Dear colleagues, today I would like to present some information with regards to PrEP in France and focus on adherence. My name is Tetiana Melnik, and right now I work at a clinical research unit, Department of Infectious Diseases, St. Antoine Hospital. No conflict of interest. And today I would like to discuss the issues, 3 issues. So PrEP in France, focus on adherence to PrEP, and the results of my research that I was involved with and presented it during the EX conference 2023. Issue number 1, PrEP in France. And first of all, I would like to give you some overview with regards to transmission of HIV and routes of transmission that we can see in Europe. With regards to the Western Europe, we can see that 40% are men having sex with men and 18% plus 16%, which will make 34% total. Those are people who have heterosexual route of transmission. Among them, 18% are women that are infected and 16% are men. In other words, we can see that this route is still relevant, and women are infected even more than men in Western Europe, including in France. With regards to prophylactic preventive strategies that we have today it's TASP, treatment as prevention, which is antiretroviral therapy, PrEP, which is pre-exposure prevention, and PEP as post-exposure prevention. And in accordance to EX guidelines, we can see that PrEP recommended to patients with risk who have had STIs as part of their history, some use of post-exposure prophylaxis also included here, or who have experience using chemsex. And also, it's not only for men having sex with men, but also for heterosexual women and men who are inconsistent in their use of condoms or who have multiple sexual partners, and high HIV infection risk. And the regimens in Europe, PrEP regimens, which is Truvada, it's either daily or on demand. Also, it's necessary to say, and EX guidelines also include that on-demand research with regards to PK/PD studies were done for cisgender women, but for transgender women, there were no PK/PD studies like that. Also, EX says tenofovir alafenamide use as PrEP and long-acting regimens. And now let us look at the recommendations and guidelines that are relevant for France. This is so-called Rapport Morla, which is the consensus with regards to medical care for people living with HIV, prevention, and screening. And this slide summarizes the part for prevention, and it includes pre-exposure prevention and all the aspects, also prevention for STIs, viral hepatitis, chemsex, and vaccination. And briefly, just to remind you, what are the indications included into the French guidelines? First of all, a lot of attention is paid to men having sex with men and risky behaviors, which is unprotected anal sex with at least 2 partners, several episodes of STIs, including viral hepatitis as well, also having had several uses of post-exposure antiretroviral prophylaxis and chemsex, and also can be or may be considered PrEP may be considered on a case-by-case basis for other categories of people, like intravenous drug users or those providing sex services for money, and also people who are subjected to violence and have unprotected sex. With regards to PrEP monitoring, according to French guidelines, it is done before PrEP, and also it corresponds to European guidelines as well. So it's creatinine, HIV serology, also serology for A, B, and C hepatitis, ALT, AST, and screening for STIs. 1 month after PrEP use, repeated screening for HIV is done, and then every 3 months, all those tests mentioned, except A and B, the hepatitis serology is done, because if it's negative in the very beginning, vaccination is recommended. Also, I would like to pay your attention that PrEP on demand for chronic hepatitis B and to women is not recommended. And major focus, major things or items depicting PrEP in France, the Minister of Health declared at the end of 2015 temporary recommendations with regards to tenofovir use for PrEP and continuously and on demand. And since 2016, it was authorized already and is used in France on a continuous basis. And who can prescribe it? It's doctors working in the hospitals and so-called CGIT centers. So I will talk about those centers a bit further. And talking about general practitioners, they have the right to monitor PrEP. And starting since June the 1st, 2021, PrEP initiation started to become possible by general practitioners as well, not just the hospital specialists, by general practitioners outside of the hospital. So what is CGIT? So you can see the abbreviation. I also provided the English and the French options: free information screening and diagnosis center for sexually transmitted infections, HIV, and hepatitis. And those centers, they were established in 2015, and such centers exist with every hospital. In Saint-Antoine Hospital in Paris, all possible activities are provided, characteristic for CGIT centers, including PrEP counseling. Also, I would like to point your attention to a small study that was done, or survey rather, in 2018 among general practitioners, and 351 responded to the survey, and the majority of them support PrEP, but only 6.3% had provided it, have the experience providing it, and 12.8% had experience monitoring PrEP. And there were some doctors who were prescribing using PrEP, some that were not using, and those who did not use PrEP had barriers, and it was discomfort in prescribing for a new indication as one of the barriers. Identify patients not at risk of HIV, absence of health insurance for some patients. Also, such doctors had a lack of knowledge of the sexuality of their patients. Also, they needed additional training. And there were other barriers mentioned, like fear of side effects, effectiveness less than 100% to their opinion, risk of low adherence or decreased adherence, risk of resistance to HIV, price, and others. So many barriers, as you can see, in general practitioners were identified. And that is probably a common problem, characteristic for many countries. And this is statistics 16 through 22. We can see then more than 64,000 patients involved, and overall 2.6% of women were involved with PrEP. And in 2022, it has increased to 4%. And that is why the paradigm has changed and is changing in France with regards to initiation and prescription of PrEP. And actually a lot of attention paid to prescribing to women and migrants, sub-Saharan populations, and commercial sex workers. With regards to adherence, couple of studies. The first one was IPREX, and it tells us about the efficacy. And efficacy in this study showed among the patients that were included, the to reject the null hypothesis of inefficiency, it should be less than 30%. So these are the results of 3 big studies on PrEP, and as long as the lower limit for CI was less than 30. So we can see in IPREX it's 24, for partners it's 67 and 75, and TDF2 study 62, from 16 to 83%. So why such studies are considered to show the efficacy, although the overall figures seem not to be so good. But if we look at the concentrations of tenofovir, checking the tenofovir levels in blood, so among those that had at least traces of tenofovir, the efficacy in IPREX was from 40 to 99%, for partners 57 to 95% of efficacy, and for partners PrEP FTC TDF 56 to 98, and no difference among men and women. So we can see if there is a good adherence, and means with good adherence, PrEP efficacy is going to be high. And this slide shows it really well. What we can see with increased adherence, efficacy also rises, it increases. It seems to me it shows it really well. And other studies showing efficacy for daily and on-demand regimens, Prevenir study that was developed for Paris region and done in Paris region. No difference between daily and on-demand, but this actually pertains to men, but women were not included into that study, so it's about men. HTPN 084 study, the part with regards to women, there were 2 groups, and in the first group, cabotegravir and tenofovir and placebo cabotegravir. And we can see the group including cabotegravir long-acting regimen. So for this group, we can see the number of patients in whom HIV was identified differs with tenofovir group. So the concentration of cabotegravir is maintained in blood, and that allows it to protect a person from HIV infection. And it's much better rather than daily use of pills. And at the end, I would like to show you the results of a small study, observational study, that was looking at factors influencing discontinuation of care of women seeking pre-exposure prophylaxis, PrEP, in San Antoine Hospital. So, and the purpose of the study was to describe who is seeking PrEP, who comes to get this care, to look at the factors influencing discontinuation of care, receiving care like PrEP. So it was observational cohort study. The patients were looked at between April 17 and April 23, and its follow-up continued until PrEP discontinuation or the end of April 23, whichever occurred first. And factors associated with discontinuation were assessed and looked at in this study. So what were the results? Out of 175 women that were screened, 161 women were included into the analysis. 14 did not initiate PrEP. Median age was 32. Median PrEP duration was 8 months. Mostly those were women with origin from South America. Some part, small part, is from Europe and sub-Saharan Africa. And PrEP discontinuation was reported in 98 participants. Among them, among those who discontinued, 2 transgender women from Europe and South America. They acquired HIV after 12 and 14 months, respectively. And after multivariate analysis, it was seen such factors like transgender woman influences the PrEP discontinuation. So they have a lower risk to discontinue PrEP, but those having a sub-Saharan origin, they have a higher risk to discontinue PrEP. And conclusions for the study, we can say that it is true to be a transgender woman means having a factor that associated with a higher rate of retention in care. Probably that is related to the fact such women are more informed with regards to the risks and all the services, whereas women coming from sub-Saharan Africa, they have a higher risk of PrEP discontinuation, and probably care should be more focused for this group of women. And conclusions, I would like to say that PrEP is available and absolutely free of charge in France. PrEP could be prescribed and people can be monitored both in hospital, in CGIT centers, and also monitored by family doctors. Retention in care is an issue to take care about, because probably it is a problem for a lot of countries. It's not only for European countries, but it's probably a global challenge. And with regards to new regimens, yes, they are available in the frames of clinical trials, and patients are broadly involved into such trials to be able to get new possibilities, new results, and to improve PrEP care for both men and women. Thank you for your attention.
Thank you, dear Tatiana. Very interesting mini lecture from you. Thank you. And there are a couple of questions to you. And namely, how often and which tests do you use to test for HIV during PrEP in France? Thank you for this question. First of all, I would like to express my gratitude for this invitation. It's a great honor to me be part of this webinar. And with regards to the question, with regards to HIV testing, usually it's a serological HIV test, third or fourth generation ELISA or immune chemiluminescent assay. Maybe PCR might be done and viral load may be done, but it's just for certain categories with recent high risk. But usually, according to the guidelines, usually it's serological testing. Not the rapid tests, laboratory, right, laboratory, not the rapid tests. Thank you. May I ask a question? And how much with regards to time do you have to wait for ELISA results? Next day, the results are available, or any other test that I have mentioned, so you get the results next day. Maybe if it's a molecular genetic for sexual STDs, so maybe for them it's a couple of days, but otherwise it's just next day. And usually you plan the next visit to the patient, usually a couple of days later when it's convenient to the patient. We are not waiting long. Thank you. Thank you. And also, dear Ms. Tatiana, can you tell us whether a woman who is breastfeeding a baby, can such women take PrEP in France? A breastfeeding woman, yes, she can take PrEP in France, but there is a question or issue with regards to such prophylaxis to be continuous, not on demand, but continuous. And actually is related to the anatomy and physiology. And in order for this prevention, for this prophylaxis to be really efficient and effective. The only thing a woman, just like a man, because there was a question about the differences with regards to screening, a woman has to undergo the same tests that are usually recommended, and then we prescribe PrEP based on those test results. But a woman also can use additional gynecologist services or psychology services or mediators, so-called health mediators, like case managers, but we have a different name, like a social worker or case manager services. So along with the tests, both for women and men, additional services are provided, and they're accessible in the testing center and in clinics. With regards to tests in general, I would like to say that the rapid tests are more used for self-testing. So patients free of charge can get those like rapid tests for self-testing. Thank you. Thank you. Yes, Ms. Diana, you're welcome. Thank you very much, dear Tatiana. It's absolutely pleasant to have colleagues who are working currently in other countries who share experience. You showed the testing schedule. Is it reimbursed or by insurance, through insurance? And are there any inclusion criteria for women in order to cover all PrEP services by insurance reimbursement? Do they have to be part of key populations or other inclusion criteria? Yes, thank you, Ms. Diana. Very important for information. It's important. everyone can get PrEP free of charge, regardless of insurance or no insurance. Like we have many migrants who came from different other countries, and France is a hospitable country taking a lot of migrants. And the system is organized in such a way that all the expenses with regards to the testing, the PrEP provision monitoring are covered by so-called regional health agencies. In Ukrainian, it's like the health department, like an organization like health department in Ukraine. So even if a person does not have insurance, all the expenses are reimbursed, covered, including PrEP. Thank you.
Дякую, спасибі.
Thank you really very much, dear colleagues. And now we have to move on. And what I suggest to now come to the next lecture. Oh, Anka, would you like to say something?
Yes, thank you. I just wondering one quick question. So the PrEP is reimbursed for tenofovir or for the long-active antiretrovirals? Because I do know they have a highly priced value at this time point.
Thank you. That's a wonderful question. Right. So at this point of time, emtricitabine, tenofovir, Truvada, generic and brand drugs as well. Others are available. Other drugs are available only in trials. With regards to reimbursement, the country is reimbursing either by insurance, or if there is no insurance, there are other ways how to reimburse that. So any person can get such services free of charge. Thank you.
Дякую.
Thank you. Thank you. Ms. Tatiana, Caroline, do you have a question or comments?
Запитання, прошу.
Or quick question if you have that.
No, thank you. I would just like to thank our speaker, Tatiana, and it's very interesting because I think it's an example of really an advanced use of PrEP in terms of implementation. And thank you very much for giving us that overview.
Thank you. Thank you.
Знову пізнавальна лекція.
Truly, truly wonderful
Коротеньку дискусію.
lecture, mini lecture, but we'll be coming back for the discussion and other questions right after the last lecture. And now we are going to hear the last mini lecture for today. It's PrEP for women in Ukraine as one of the key measures and part of the comprehensive HIV prevention. Ms. Diana, you're welcome.
Good afternoon, dear colleagues. My name is Diana Shevchenko, and I'm an infectious disease specialist at Public Health Center. Today, we are going to talk about pre-exposure prevention for women in Ukraine as one of key interventions for comprehensive HIV prevention. And dear colleagues, I have no conflict of interest. First of all, I would like to show you the successes with regards to responding to HIV infection, to show you the HIV care cascade in Ukraine. As you can see, also considering the situation, military activities going on in Ukraine, we have some changes to this cascade, but still the success is substantial. In red, people knowing their status 79%, 75% of them are on ART, and 95% are virologically suppressed. Also today, we are going to talk about the prevention of HIV in Ukraine, what was the legislative basis for PrEP implementation, and what are our successes and plans for future. And today, let's talk about the national strategy and standards for PrEP. So the legislative basis for PrEP implementation. In fact, PrEP we started to have in Ukraine in 1718. It was started for men having sex with men in the city of Kiev, but with regards to legislative basis, more. In 2019, PrEP started to be part of national strategy for HIV/AIDS, viral hepatitis, and tuberculosis response 2030. Also, the same year, the clinical protocol for pre-exposure prophylaxis of HIV appeared. In 2021, standards appear for pre-exposure prophylaxis and post-exposure. In 22, they were updated, and also There were standards developed, approved by the order of the Ministry of Health, and a separate appendix was added there about pre-exposure prophylaxis. So 2023 was a significant year for us because it started to be part of the law of Ukraine about response to diseases related to HIV and about legal and social status of people living with HIV. In this law, there is a definition of pre-exposure prophylaxis and also free of charge provision of PrEP medications also are described there. And also the national strategy that we mentioned, there are some strategic goals, operational goals with regards to PrEP. It is part of strategic goal 1, which is decreasing HIV incidence and decreasing AIDS-related mortality. So PrEP is part of that. So operational goal number 1 is to prevent new cases of HIV infection. So this is actually, that's why it's part of pre-exposure prevention, pre-exposure prophylaxis. And as I have mentioned, the standards that we use in Ukraine are approved by the Ministry of Health, and there is a special appendix there with regards to PrEP. And if the colleagues are interested in more details, you can go and use this link. And also, there is a special issues in Ukraine for PrEP for women, and also part of the standard with regards to prevention of mother-to-child HIV transmission. So here you can see the standard itself, the link to it, to the standard, and some citations, what the standards says with regards to pre-exposure prophylaxis. Number 1 is women with high risk of HIV contraction via sexual route need to be provided with detailed information with regards to pre-exposure prophylaxis. Also, here, the standard talks about PrEP for women from serodiscordant couples, and women have to be informed about safe use of PrEP using along with hormonal contraception. So in Ukraine, we use the comprehensive approach towards PrEP, and there is a special standard, as I've mentioned, for PrEP, and also PrEP for women is included into the standard about mother-to-child prevention. So we talked about legislative basis with regards to PrEP, but what about the infrastructure for PrEP services provision in Ukraine? So in Ukraine, our healthcare facilities are contracted by NHSU along the program for health benefits. And one of the packages is diagnosis, treatment, and case management of people with human immunodeficiency viruses. In Ukraine, according to this package, healthcare facilities contracted by NHSU can provide services of pre-exposure prevention. And here you can see regions of Ukraine with the number of sites working using on PrEP. Unfortunately, temporarily, these services are not provided in Luhansk Oblast and Crimea, but we believe that in the nearest future will be successful to renew the services in Luhansk Oblast and in Crimea. So 225 healthcare facilities provided PrEP services as of the 1st of January 24. We do the decentralization of services, we expand them, and we also started to provide primary healthcare facilities to provide PrEP services. So you can see the overall infrastructure, how it is organized in Ukraine with regards to PrEP services. So in other words, so we have healthcare facilities, like, for example, primary, secondary, tertiary healthcare level provision. And also we have private type of ownership healthcare facilities also involved in providing these services. NGOs as well, they do counseling clients before referring them. They actually do the referral, case management. And also there's another service involving health professionals to providing PrEP services at NGOs themselves. Also, you can see that the map has several colors. And please, dear colleagues, please have a look at the light yellow. That's where predominantly clients from men having sex with men are included into that group. But in more orange color, you can see that those are predominantly clients from the discordant couples. With regards to the history of implementing PrEP in Ukraine, I've mentioned that we've started to get PrEP in 17. It was a tablet, but in 23, we already have received to be able to use the injectable form, and in 2024, cabotegravir long-acting, it's going to be available in Kiev and Lviv in Ukraine to use that among the group of people, men having sex with men. And you can see the successes down there. More than 13,000 clients, which is 13,147 clients, have received PrEP services in Ukraine in 2023. And our short history of implementation, we can see the different working group meetings and trainings, pictures from there. In the city of Kiev and in each region, we have regional coordinators, and they are involved in PrEP services, in advocacy with regards to implementation, involving different key populations. Only in Luhansk Oblast, there is no coordinator there. So how it is organized in Ukraine, we have a monitoring system. Healthcare professionals enter data, and that allows us to understand services for key populations and how to expand them. And so in SRD, we can see the frequency, the regimen, key population type, HIV testing that were done for clients. Also, age and sex are available in that monitoring system. Couple of words with regards to PrEP client profile in Ukraine. So you can see that the biggest quantity, 41%, is men having sex with men. This is the breakdown. 39% is people using drugs, 19%. 39%, it's for discordant couples and risky behaviors, 19% people using drugs, and very small percent, 1%, is people providing sex for money, and 0.5% is transgender people. So very few of those people are involved in PrEP services receipt and uptake. Here you can see change in number of new PrEP clients. 25 to 49 years is men having sex with men. Those use it most of all. So you can also see on the same diagram the proportion between men and women, that 25-49 is the biggest age group involved among the clients overall receiving PrEP services. Most of them are male, and the much smaller percentage is women. So the analysis of the information is possible due to this informational monitoring medical system where healthcare professionals enter all the data. With regards to new clients involved in PrEP services, you can see the biggest of them was Q4 2023, and you can see the breakdown by different oblasts. So regardless of the military activities, frontline regions continue to provide PrEP services for population, and also they even try to involve, and they do involve, new clients. So this is rates of PrEP clients returning for repeated visit, and the number of those people increase. Q4 last year, it was 4,724, and the breakdown for different oblasts. And without informational and information awareness campaign, it was not be possible to involve that many clients into PrEP services. So we do that in all oblasts and on the national level, and the publications are in the Facebook, on PHC Center, in different messengers, social mass media, and we have a separate landing web page. You can get more information with regards to PrEP in Ukraine. Dear colleagues, thank you very much for your attention. Of course, we are working towards the victory. We will survive and we will win very soon, and we believe in our victory. Thank you for your attention.
Дякую, пані Діано. Дійсно віримо.
Thank you, Ms. Diana. Yes, we do believe in our victory, waiting for that.
Вам спасибі за
Thank you so much for this very interesting, brilliant,
інформативну лекцію.
and very informative mini lecture. And brief question right away. What's the plan? So how many people will get access to cabotegravir in 24? Thank you for this question, Sergey. With regards to, as per the quantities that we are getting from our partners, it's 200 courses, annual courses for the group of men having sex with men.
Мгм. Зрозуміло.
All right. Yes, I see. Thank you.
Анко, може, у вас
Caroline, Anka,
Діани?
do you have questions to Diana?
If I may intervene, I am just really jealous about your program and what you did and how you implemented it, and really looking forward, and best of luck. I'm really impressed with the data that you presented. So really congratulations.
The same
Дякую,
from me.
велике пані Анко, дуже приємно.
Thank you, Ms. Anka. Thank you. It's my pleasure to hear that. Thank you.
Same for me. It's great data you have presented, and I'm really during your presentation, I thought this monitoring is really amazing. So, what do you think if we talk about women? What do you think, in your personal opinion, because you now have so a great insight in what's going on in practice? What would women need most to have, as you've shown, the part of women is very small. What would they need in the future, maybe in the upcoming year, in your opinion, to get more involved in those prevention strategies?
Дякую, велике пані
Thank you very much, Ms. Caroline, for this question. So now we are involving more, not just infectious disease specialists, but other specialties, gynecologists, for example, to training, first of all, to inform women with regards to availability of such services and their efficacy, because training information is really important. First, we need to convince the doctors, the healthcare workers, with regards to accessibility and efficiency of PrEP services, because if doctors believe that this prevention is efficient, they will provide and convey the knowledge to our women. And also we work on accessibility of information with regards to healthcare facilities where PrEP is available. We have chatbots, and we can find this information also on PHC Center, Public Health Care Center. Also, there is information about that. So we would like to involve first of all, as I mentioned, the healthcare specialist. We have a lot of internally displaced women, by the way. Also, we are planning to work in those stations or areas where such women are accumulated, internally displaced women are accumulated. So just to inform them about the availability of such services. Thank you.
Діано.
Thank you, Diana. Thank you. Yes, Ms. Tatiana. Thank you, Ms. Diana. Very interesting, informative presentation. Thank you for your work. In fact, it is really important in such difficult times to do this work and do it efficiently. And also, I would like to point attention with regards to migrants and about the internally displaced people, including women, how to involve them. It's very important to inform and potential people who might potentially receive PrEP, but also, to me, my personal opinion, yes, it is really important to inform doctors and involve not just the gynecologists, although it's a target group, but general practitioners as well with regards to PrEP, as information shows, the information that we have here in France, it's not always that doctors are ready to accept new information, including doctors in Ukraine. So probably it is going to be a really important approach, direction of work. Doctors require training. I remember my times when I was getting trained, how important it is. So thank you for that information. Yes, thank you really very much, Ms. Tatiana. Actually, we have actually started this way. We started to involve family doctors, but thank you for mentioning that. It is true, we are moving in that direction, trying to do that. We also tried to include PrEP issues as part of the post-diploma training for doctors in order to involve more doctors to that. And also another thing, just to focus on another thing, maybe people who are faced with PrEP prescription for the first time, I mean doctors, for them it's really important and difficult to define the risk, whether the person needs PrEP or does not PrEP, or maybe doctors think maybe a person is not at high risk and they don't require additional drugs. So it's important to define the risk. Yes, I agree wholeheartedly. Thank you, Ms. Tatiana. Thank you, dear colleagues. And we have more questions to our representative, to Ms. Alina. What's the epidemiological situation with HIV infection in your region? How many people are getting a PrEP in your clinic? And what's the proportion of women among those? Yes, we would like to hear about the city of Dnipro in Ukraine, the experience in your region. Thank you very much for this question. In our region, the epidemiological situation is quite difficult. Unfortunately, HIV virus is spreading among the population, and the cumulative number of HIV-infected people increases. Quarter 1 in Dnipro, we see decrease the morbidity by 34%. 249 new cases of HIV, 26.5 cases per 100,000 population. Heterosexual route is prevailing, parenteral 35.7, homosexual 3.6, vertical 5.5. And among the first newly diagnosed, 70% of women, men, 29 women. For women, sexual route of transmission with regards to age. And this is Q1 2022. Children under 18 months who are monitored, 6 babies infected, 20, 39, 20, 40, 49 years, 28, over 50, 19 women infected. And today in our AIDS center, PrEP is 482 patients receive PrEP, 62 women out of those 480 something. So that's what Diana has mentioned. We have a small proportion of women on PrEP, unfortunately, and median age is 38 years old for those women. From 26, she is the youngest among them, till 54 years of age. The regimen on demand is accessible, but the daily regimen is used more. I just wanted to ask whether do you plan in Europe, do you plan to give on demand to women? Thank you. I can answer if I may. In fact, if we talk on demand for women, in cisgender women, we have studies saying that that regimen on demand is not efficient for them because time is needed for tenofovir accumulation in mucosa in order for it to be efficient. So it's only continuous daily use that is necessary, and no less than 7 days before unprotected sex needs to this drug needs to be taken in order for a woman to get the tenofovir and emtricitabine. Thank you. Thank you.
Дякую, пані Тетяно.
Thank you, Ms. Tatiana. Caroline, Anka, would you like to talk about that or comment on that? So, in other words, so what's your attitude towards PrEP on demand for women? Do we have few trials, or it was already proven it's not efficient? What's your opinion?
I think what has been said is that it takes too long to arrive in the vagina, in the mucosa, and I think, I don't know all the trials, maybe there's somebody here who knows them, but I think there's no research about this, but I'm really interested in new ways of giving PrEP. Like we have seen that with a long-acting, or my dream as a gynecologist would be to have a contraceptive combined with PrEP that we could use. Like this is something that would be also in a family planning clinic, but I'm not sure if Tatiana knows more about why. I think it's just, it takes too long to be effective to do PrEP on demand in women. That is what I know, but I would like to ask the expert.
Сергій, включи мікрофон.
Дякую, Каролайн.
Thank you, Caroline. Thank you.
Дуже дякую. Ну, я думаю, що
Yes, thank you really very much.
дослідження, які
But
я пам'ятаю,
I'm sure there'll be more studies, more trials to look at that. I remember studies saying that PrEP is not for women at all. And then also they reported that women didn't adhere well or something. I understand that there is difference between men and women, but hopefully that for women, we also will be getting some additional options like long acting. Yes. So we are starting to get that in Ukraine, but we start from men having sex with men, although they are not the biggest proportion of our population of people living with HIV in Ukraine, but they are more active. They have strong advocacy, and now I have a dream that women will also get access to new options, PrEP options, and there'll be a bigger proportion of women in our population who have access to PrEP. So Diana has mentioned 13,000, and what's the percentage of women among those 13,000 on PrEP? Like 13,000 something that I remembered, but the proportion of women. Alina, out of 500 people who take PrEP in your clinic, 62 are women, right? And the rest are men, right? So hopefully it will change, so we will get some equality or parity at some time. It's okay, but that means there is room for development. Thank you really very much. So what do we do? We have just some more time. We have, yes, some time and many questions. I think unfortunately we will not be able to answer all the questions, but we will try to do that offline later on after our webinar. and we will publish that on our website. So we talked about age a little bit. There is an interesting question. Since what age we can start prescribing PrEP? So we are talking from the legal point of view and in medical practice. So you mean the adolescents. And so if there is a guardian, for example, is it necessary to get a permission from the guardian for the adolescent to get PrEP?
Колеги, це запитання для
Colleagues, it's a question to everyone.
Тобто до ПрЕП мають доступ дорослі
In other words, so there is access of adults and adolescents to PrEP, but whether an adolescent need permission from an official guardian or from parents, yes, so that's the question. So, so what's the situation in your countries, like France, for example,
в Європі.
or in Europe in general? I might say that I probably cannot answer this question, but I know there is access for adolescents, but whether the permission of a guardian is necessary with regards to testing, so adolescents can get tested, no problem. But with regards to PrEP, I don't know. But for sure, starting from 18 years of age, everyone can get such services, no problem. With regards to testing, again, adolescents can get tested. But with regards to pre-exposure prevention, I will have to clarify. I will have to look for the answers. And then probably I will add my answer later on. Thank you, Tatiana. Well, probably that's not the only question that we will have to answer offline in our additional time. Yes, you're most welcome.
If I may comment on that question regarding the legislation in Romania that kind of mimics European legislation. From 16 years of age, you can get tested without your guardian or parents signing it. But regarding PrEP, which is considered to be medication, you need approval. So until you are 18, after the age of 18, everything is much, much easier. But these are are the limitation at this time point. I don't know if there are some exceptions in some countries. Definitely, it's an important issue to be raised, and it's a population that we need to address as well.
Дякую.
Thank you.
Доктор Анке. Ну що я думаю? Я дивлюся,
Thank you, Dr.
що
Anka. So I'm just looking at our watch. It looks like we need to
чи ще ні? Чи питання будемо задавати?
more questions or comments already.
попередньо дійсно ми вичерпали.
Yeah, according to our preliminary agenda, like our time is up.
Я думаю,
So maybe
можливість висловитися фінальні
we just have some time for final comments,
побажання.
wishes, final wishes.
Я пропоную коментарі.
I suggest comments, yes.
Шановні наші
And with regards to the rest of the questions, dear participants, there will be answers, but offline. And if we may,
Давай.
but Alina wants to ask a question. All right, using this opportunity, please ask. Well, it's interesting for me. What's the situation with women in Europe on PrEP? Do you have a lot of women on PrEP? And what's the secret? How do you involve them to this service, PrEP service? Thank you. Well, maybe we can start from France, yeah, if it's okay.
Давай тебе будемо.
All right, Alina, thank you for your question. I can say that if we take our experience, because we've started it to use it since 2015, but actually we've started to widely use it in 17-18, but over the last 5 years, the number of women has increased 5 times, women on PrEP. But still, the overall percentage is small compared to women. I can say that in the first half 2022, if we take all the population, only 4% of the whole population were women on PrEP. It's not a lot. Not a lot. So I can say that in your oblast, the percentage of women on PrEP is higher. With regards to peculiarities, how to involve women, so it's still being studied how to do that, because there are lots of problems here, especially how do you involve migrants, women migrants. And men migrants, including men having sex with men, but those who came from other countries who are migrants and MSM, right? So it's difficult to involve them as well. So we are talking about difficulties to involving all those populations. And with regards to like more about involvement, it's comprehensive services that we use. Usually it's STI screening. Also, we provide that when we provide social services, documents, official documents, provision services to get them documented. But there are other specialists, mediators, we call them mediators, like case managers, social workers, and they provide information about PrEP as well. And they can get other consultation of gynecologist, sexologist, and other specialists. So all these factors help in involving those groups, including women. And retaining them is a problem, retaining in care, because we are talking about risky behaviors and others, and people move usually to other places to live. It's difficult to control that. So PrEP is not antiretroviral therapy. Here, it's not the task to retain in care. So here, it's more about information, especially when there is risky behavior. Hopefully, I answered your question. Yes, thank you. Thank you. Yes, maybe Diana would like to. Maybe just a few words. Sorry. I just wanted to share some information with regards to the percentage of women. So in my presentation, it was absolute numbers. So here it's 23%. So not many women involved in PrEP services. It's just general information for the colleagues. Thank you, Diana. Thank you. 23%. Out of 13,000, right? 23%. Well, thank you. It's good.
Не такі вже погані.
Not bad.
Будемо стремиться к улучшению.
Yeah, of course, we would like to strive to have it even, to get it even better. So, Diana, maybe we will start with final comments. We'll start from you. You're most welcome. Dear colleagues, in fact, yes, I really would like to thank for this invitation to participate in this webinar. A wonderful experience for me, because I got and learned the experience from other countries that we might implement in Ukraine. Thank you, dear colleagues, for your wonderful speeches. I'm sure we will continue to share information in future. Thank you. And I also believe that we'll be able to better implement PrEP services in Europe and globally to overcome HIV infection, and it will be totally controlled in future. Thank you. Thank you. Yes, we do hope for that. Ms. Anko, couple of final words.
Well, a big thank you from my side as well. It was a pleasure to be part of this discussion, as PrEP is really an important issue and should be an important issue. If we will discuss about it, definitely it will become the subject of the day. So it was a learning experience from my side. And again, thank you for the kind invitation to join the speakers and the board and everybody's input on this special issue. Thank you.
Дякую.
Thank you. Once again, thank you for joining us, Ms. Tetiana. Once again, thank you for this invitation. It's an honor to be part of this webinar. I hope that in the nearest future, we will have the opportunity to meet offline, and hopefully the war will be over soon and we'll be able to share our experiences offline anytime at place of the world. Thank you. Thank you. Ms. Alina? It was a pleasure for me. Thank you for inviting. It was kind of unexpected. I learned a lot. A lot of studies was shown. A new experience was heard. We will try to be closer to French experience. I loved their experience. We will try to keep up. Thank you.
Дякую. Дякую, що ви сьогодні з нами.
Thank you. Thank you for being with us. A couple of words from me, dear colleagues. Don't forget, tomorrow
Другий день нашого
there is going to be second day of our webinar, 10th webinar of WAVE on track to improve quality of life women living with HIV in Ukraine. Please undergo your survey, and it's not about your knowledge, it's about our webinar, whether you liked it or not, and get your certificates, and we will see you tomorrow. And then at the end, I would like to give the floor to our two chairs, Ms. Svetlana and Ms. Caroline. You're most welcome.
I would like to thank all the participants. It was really inspiring and heartwarming to see such a great sharing of experience and also learning from each other. And I would like to thank especially the speakers, but also Sergey for being a brilliant moderator, and he always keeps us in time, and he always looks for the questions and answers that we fit everything in. Thank you, Sergey, for your great work in always. And from my side, I would like to thank you. I mean, it's, as I said, I'm also wanting to see all the Ukrainian very friendly and warm-hearted people again live soon. And I'm really hoping that we can keep this up until then. And thank you very much for your time. And I would like to hand over to the second person I would like to thank, because yeah, I give you the last word, because Svetlana, I really like all your work on this workshop, and thank you also. See you tomorrow.
Ну, я що можу сказати? Тільки дякую.
What I can say, of course, thank you, thank you, thank you, thank you, dear colleagues. Thank you, dear. And from the bottom of my heart, from all of my heart, Caroline, Anka, thank you for this warm atmosphere that we always have in our conversations and discussion. Thank you for your help to Ukraine. And thank you for your attention towards this topic. And Caroline was asking, actually, so what do we have to change in EX? I would like women to get easier access to PrEP. And I want not to use the key populations, but turn towards vulnerability definitions and terms. We want to defend vulnerable, not just the key populations, although of course, we need to deal with key populations as well. That's all. Caroline, everyone, I love you. Thank you. So see you tomorrow. Have a good night.